He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Hey folks, it's Stay Off My Operating Table with Dr. Philip Ovadia. We are joined today by Dr. Cassie Smith, and we've been chatting here prior to the show got started, and Phil and Cassie started saying stuff that was way too good not to get captured. So I stopped them in the middle of the conversation. We're going to dig into it. Phil, take it away, man. Dr. Cassie Smith.
Yeah, I've really been looking forward to this conversation since we got it on the books. Dr. Smith, admittedly, is not someone that our paths had crossed, but somehow the interwebs brought us together and started looking into what she has been doing and what she talks about, and immediately knew that I wanted to have a great conversation with her. So I am really looking forward to this one. And with that, I'm going to turn it over to Cassie to introduce herself, give your background, let us know why you got interested in medicine to start with, and then why you got focused on hormones, and then we'll go from there.
Awesome. Thanks for having me, Dr. Phil. So I can always remember from when I was a little kid just being very interested in the why of things. I grew up in a smaller town in Missouri, and I was very fascinated by animals and like why they got sick, things like that when I was little, but then it kind of translated into people. And so I just always had lots of questions. I lived in a town that was more rural and there were a lot of very overweight, sick people. And my question would always be like, why are people like this sick? And then I remember as a kid going to Daytona Beach on vacation. And I was like, the people here are very different than the people where I live. They looked different. They could walk down the beach. They were eating different things. And so I was just fascinated as a child, like, why do some people look like this and other people look like that? And why can some people run really fast and others couldn't? So that's kind of where my love started. And then I just quickly realized, okay, I think I want to be a doctor. I also did not want to continue to live in the town that I lived in and be a farmer or work on boats or work in a jean factory. Those were your options. And so I ended up in medical school. And interestingly enough, because I believe in God and the universe, threw at me right when I went to medical school, Graves' disease. So I got pretty sick in medical school and I didn't know why. Come to find out I had Graves' disease. I now know, looking back, it was probably because I wasn't raised on the best diet, lots of ultra processed foods, lots of just not sleeping well, not taking good care of myself, and then threw myself into medical school, which medical school doesn't teach anyone to be nice to themselves. And so I developed this autoimmune disease. But when I went to see an endocrinologist, the only thing they would say to me is, you need to take this medicine. And I would ask why. You just do. It doesn't make me feel good, too bad. There were just never good answers. And I was very frustrated as the patient. I want to know why I have this. I want to know how to make it better. I just don't want a medication. So that's kind of how I got interested in endocrinology. And then I'm going through residency, get into fellowship. I ultimately developed Hashimoto's after Graves, because thankfully I did not ablate my thyroid like they told me to, just because that's what you do. And so then I went down the rabbit hole of Hashimoto's. I ended up with PCOS and insulin resistance and infertility issues. And so through all of that, being a very frustrated patient, seeing specialists after I got out of school, I was seeing other endocrinologists all over the country who none of them could give me a good answer. And I was frustrated because I went through fellowship training and didn't have an answer for myself. So I'm like, not only am I being medically gaslit by my own specialty, but I don't have an answer for myself either. So this is pretty bad, right? And so that's where I just got sick of being sick. And so that's where I learned functional medicine. I was like, there's got to be a way for me to feel better. I started learning about the gut and gut health and really dove deep into hormones, because even though I have a board certification in hormones, metabolism, and diabetes, they teach you nothing in fellowship about hormones or metabolism. Nothing. And so that's where functional medicine drove me to this place in 2020. I got really sick, found a doctor in Dallas to help me get better. And then I've fixed my health in so many ways since 2020. And so that's what came of this book that I wrote. And then now I help thousands of people in 46 states all over the United States get better every day via our telehealth practice. So it's pretty cool.
Yeah, and Jack and I, of course, have heard this story different versions of it, right? Lots of times, but it never ceases to amaze me, right? The specialists that we go through, the advanced training that we go through, and we get something in that specialty like ourselves and we can't fix it. And it's, wait, what are we doing here? How are we supposed to have helped other people? If you don't mind, I'm going to take a little step back because we've had one other endocrinologist on that I can think of, but I don't think we really went deep into what is endocrinology. And so let's talk a little bit about that. Like, what is the specialty of endocrinology? And then you mentioned a couple of the things that you were diagnosed with: Graves' disease, Hashimoto's, and people might have a little bit of a sense of what those are, but I'd love to unpack that a little bit as well.
Yeah, great question. So endocrinology technically is the study of hormones. So hormones is a pretty broad topic, but a hormone is something in your body that when it is activated or when it works on a distant organ. And so I joke that endocrinology is everything that any other specialist didn't want to deal with. So your thyroid, right? Osteoporosis, your bones, how your bones break down and form, diabetes, because that's just really hard and complex and affects your entire body, hormone production, so estrogen, progesterone, testosterone as a woman or testosterone as a man, although they don't do a great job of teaching us about that in school, because I was in school during the WHI times. So we've got thyroid and then a lot of weight, PCOS, weight, things like that. But any pituitary issue, your pituitary gland is the organ that's positioned literally in the center of your head and is like the command station for your entire body. So it's what tells our body to make sex hormones and make thyroid hormone and make growth hormone and make cortisol and make ACTH and all the hormones that help keep our body functioning. And so endocrinologists are supposed to be the gatekeepers of all of that, of all of the organs in your body that produce hormones and then how those hormones affect your body. So that's what the study of endocrinology is. Diabetes just got lumped in there, I think. And they call it metabolic, like we have a metabolic degree, but unfortunately, as doctors, we never got trained anything about metabolism. Like I never had a lecture on nutrition. I never had a lecture on gut health, but that's the certification that I have. So that's endocrinology. It's a lot of people don't know, and that's a good question. A lot of people think of endocrinologists like, oh, I see that person for my diabetes, or I see that person for my thyroid. And we do that very well. That is one thing that we learn a lot in fellowship about. But we also look at, or we should be looking at your hormone health, making sure your pituitary is functioning well, your bone health, those type of things. To answer your question, Dr. Philip, about Hashimoto's. So Hashimoto's is probably the most common hormone disorder plaguing women, period. I would say of reproductive age, but PCOS is probably the number one of reproductive age women. But Hashimoto's is where your body develops antibodies or starts attacking your own thyroid gland. So for whatever reason, and there's lots of theories out there, the things that are scientifically fact-based is, number one, in this country, we spray food with very damaging pesticides and herbicides at times, one of which is glyphosate, which is in wheat and gluten. When you have a leaky gut,
This is Roundup.
Roundup, yes. When you have a leaky gut, meaning your gut is damaged from stress, from sleep issues, from eating poorly, and you eat things that have been sprayed with Roundup, we know that when those antibodies leave your gut and are in your bloodstream, your body forms an immune complex to it. It's, oh my gosh, what is this? It looks very similar to your thyroid gland. So then your body starts attacking your thyroid gland as well, thinking it is an invader. And when it attacks, your thyroid cannot make thyroid hormone correctly. So that's one of the causes of Hashimoto's. We think some of the others are just that you're in any sort of environmental trigger. So whether it be lack of sleep, which I had a lot of in residency in medical school, I'm sure you remember, stress, poor nutrition, all of these things lead to your body making these antibodies or these little things that go in and attack your thyroid. And if your thyroid gland is being attacked, it can't do its job, which is to make thyroid hormone. So you become hypothyroid. And the way you know you have Hashimoto's as opposed to just hypothyroidism is you check for that antibody. It's called a TPO antibody or a thyroid peroxidase antibody. And people have levels, normal is up to 9. When I was diagnosed, mine was in excess of 3,000. I see those levels a lot. You can see them in the hundreds. It is literally antibodies floating around your body and attacking an organ that's vital to you living. So that's what Hashimoto's is. Graves is similar in the fact that it also attacks your thyroid, but when it attacks your thyroid, it gives your thyroid energy. So it basically causes your thyroid to make too much thyroid hormone. So Hashimoto's is too little, Graves is too much. So it's like it's falsely telling your thyroid, I want more thyroid hormone when your body doesn't need it. And again, it's thought that this can be due to environmental, genetic, food, sleep, lots of different issues. Also, a lot of thought is the things we're putting in our skin these days that are in our clothes and in our water and in products that we use on our skin. So a lot of endocrine disruptors you hear about are what are driving these thyroid issues. And they are rampant. And even in my career, the last 10 years, the number of people with Hashimoto's astronomically goes up. And now men are getting it. It used to just be like a woman thing for the most part. But now there are tons of men.
Yeah, I'm now in that category that I can say back when I went to medical school, we were taught that Hashimoto's was a very rare disease. It's not something we were going to see during our careers, most likely. And here we are. And like you said, it is rampant. And honestly, it is still underdiagnosed. The number of patients that come to me and they've been on thyroid medication for 20 years because they had a thyroid issue and no one ever tested their antibodies, and lo and behold, they have Hashimoto's. I kind of lose count of that these days. So it's still, is your impression the same, that it's still very underdiagnosed within the traditional system because we just don't test the antibodies? We just treat the thyroid, the TSH level essentially.
Yeah, so that's actually a very interesting point. I have read studies, and I believe this, it's estimated that up to 50 million people have hypothyroidism and don't even know it. And part of the issue with that is when you say we test the TSH, yes, we do a blood test. If you go to your doctor and you get a thyroid panel done, they're going to check a TSH. And most doctors just check a plain TSH. And what happens is if it comes back high, it will reflex itself to something called a free T4. The problem with that is multiple. Number one, free T4 and TSH don't tell me actually how well your thyroid is functioning. T4 is an inactive thyroid hormone. There's an active thyroid hormone called T3, and that's what's actually really important. By the time your TSH is high, you're super sick. So that would be like somebody saying, I'm not going to go to the cardiologist and even check my heart until it literally gives out and I'm having arrhythmias and need my heart replaced. It doesn't make any sense, right? I'm not going to do an EKG. I just want to go to your operating table and have you fix my heart. None of that makes sense to me. So your TSH doesn't even really matter, but most people listening to this have had a TSH drawn. And if it's in the normal range, which by the way is 0.5 all the way to 4.5, that's a huge range. If it's normal, everyone's, oh, you're fine. That is not the case at all. Really, what literature shows is 0.5 to about 1.5, maybe 2 is normal. If you take a woman in her 30s and her TSH is above 2, almost every single time she's having irregular menstrual cycles, she's losing her hair, she's losing her eyebrows, she has every symptom of hypothyroidism. But because our lab reference range is okay to 4, it's like, she's fine. Doesn't make sense. Also, what doesn't make sense is TSH is just your brain telling your body whether it wants thyroid hormone or not. That's all a TSH is. It's your brain releasing a hormone that says make thyroid hormone if it's high or don't make it if it's low. Once that signal is released, your thyroid gland then makes free T4 and free T3. It makes mostly free T4, and then our body's supposed to convert T4 into T3 in our bloodstream. The problem with 50 million plus Americans is we are stressed out. We have insulin resistance. We are overweight. We're eating bad food. We're not sleeping well. We're putting things on and in our body that are causing us to be disrupted. And so that T4 to T3 conversion that's supposed to happen, because the T3 is what actually works, doesn't happen because we have all this inflammation. And so the enzyme that converts T4 to T3 doesn't work. And then God forbid it does work and you actually make T3. T3 is a hormone, meaning it has to go to a cell and be accepted into the cell. And the way this works is cell membranes are made of lipid bilayers, meaning like little doors. And when there's inflammation, the doors get locked and crooked. And so then the hormone's trying to unlock the door and go into the cell, the T3, It can't when you have insulin and when you have insulin resistance, when you're chronically stressed, when you're not eating well, when you're sleep deprived. And so there's so many ways along the line in hypothyroidism that you can have issues. And the only thing somebody's looking at is a TSH, missing the T4, missing the T3, missing the fact that even though you have T3 in your blood, it might not get into the cell. And so this is where 50 million people are probably hypothyroid and don't know, because they have every clinical symptom of a diagnosis, but we are taught in traditional medicine that unless they fit in this box of the lab value and the symptom, then they don't have the disease. And that is crazy, because we should be looking at optimization and preventing disease instead of waiting till people are so sick that they have a TSH of 5.
Phil, I'm glad you paused because I'm so adept at interrupting Phil, and I have a number of questions, but I was waiting on him. So you got sick. You managed to get both Graves and Hashimoto's. And as I listened to you describe the mechanism of Hashimoto's, the thought that goes through my mind is it sounds like fixing this is a multi-leveled, multi-layered restoration of health. But we tend to, in this country, we tend to look for the quick fix, the pill, the surgery, and just one time in and out, be done with it, and go on with our lives. So my question is, am I right in thinking that this is a multi-layered approach to recovering from this kind of dysfunction? And if so, could you tell us about how you got well?
Yeah, you're exactly right, Jack. So the problem is that if you show up to my clinic and you say, hey, I have Hashimoto's and I want a quick fix, the quick fix that traditional medicine or any provider is going to say is, let's give you thyroid medicine. But if I give you thyroid medicine, whether it be T4 or T3 or a combination of the two, and I force as much of that into you as I can, if you can't accept that medicine into your cell membranes and into the cell that needs it because you're so inflamed, it doesn't matter how much medicine we give you. And so that's what I tell people. The reason you still feel like crap, and you have for 10 years, despite trying levothyroxine and Synthroid and Tyrosine and Cytomel, and I have people who come to me on every thyroid medicine in the world. There's a reason it's not working, because the medicine is not the issue. The issue is your environment is not allowing that hormone into the cell because you have so many issues. And it is a multifaceted approach, and they don't teach us any of this in medical school. So you have to go back and figure out what is making you sick? What is making you not be able to allow hormones? You have to think of your body like a highway system. It would be like if somebody got on a freeway and then tried to take an exit ramp onto the street where they live on. If the exit ramp is closed, like it is completely closed, you can't get off, and you just have to keep circling the highway and there's no way to get off, how are you going to get home? It is the same thing with every hormone in your body. Thyroid hormone, estrogen, progesterone, testosterone, insulin, cortisol, all of them. If they can't get off the exit ramp, it doesn't matter. So shoving a bunch of thyroid hormone at somebody doesn't fix them. And that's why so many millions of people still feel very poorly and say, I took thyroid medicine, it didn't change how I felt. Because it's not the actual medicine, it's that we have to get the medicine into the receptor.
So, what did you do? How did you get well?
Yeah.
Well, yeah, I want to hear what you did, but I also want to hear, knowing, I guess, after you learned what you learned because of what you did, when you look back, what do you think is such a barrier in most doctors understanding that, right? Because it makes perfect sense. It's pretty logical when you sit down and think about it. And yet we just can't seem to get that in the mainstream approach.
One of it is education. Obviously, they don't teach us this in school. They teach us how to put people in a box and write a prescription. Because to be honest with you, the pharmaceutical pharmaceutical companies run this country, right? And so that's what we're taught in school is here's the disease, here's the medication, the quick fix to fix it. And so I think that's one of the issues is we have to change the education. We also have to change the education to patients. Patients should be demanding just like I was, because I had never really seen a doctor. My dad didn't take us to doctors. He was like, you don't get sick. So when I went to a doctor and they're like, oh, here's a pill, goodbye. I'm like, that doesn't make sense. My body's supposed to work how it's supposed to. Explain explained to me. And so we don't have patients asking enough questions either, in my opinion. When patients come to me and they have this list of questions and they've researched all this, I'm happy. Most doctors are annoyed because they have 5 minutes to spend with you and they just want to write a prescription and move on. So I think there's a lot of issues. It's an education issue in med school. It's an education issue to patients. It's a time issue. We are in a system that doesn't allow doctors to look at the full picture with a patient and ask them about, do you poop every day? And what do you eat? And are you sleeping well? And how do you feel? We don't have that time. And so I think those are a couple barriers. And then it's just, again, getting out of that mindset of the quick fix. It's let's fix the actual problem instead of just putting a bucket under the leaky sink. Let's actually get a plumber to come out and figure out why the sink's leaking so we don't need the bucket. Just takes more time, but that's not our mindset in this country.
Yep.
So yeah, talk a little bit about what your journey was like then, because it sounds like you went to your colleagues, right, who had been educated the same way you were educated. You didn't get the results, or you didn't think it made sense what was being recommended. So what was your journey like then to figure out how to heal yourself, which then ultimately led you to be able to better help other people?
Yeah, so mine started with me, and at first, if you have Hashimoto's or you have thyroid disease and you're listening to this, you understand when I say thyroid people just have a different tired. It's just, oh my God, it literally pains me to get out of bed. And it's not because I'm lazy or I don't want to. It's just like I am literally so tired. And any second you have to sit down, you just want to close your eyes. But it's also frustrating to you because you're like, number one, I know this isn't normal. And number two, I'm like losing part of my life. And so for a while, people were just like, you're tired because you went through medical school and you went through fellowship and you worked too much. And this is just normal for you. But then when I got out of fellowship and I'm working like 40 hours a week at a hospital, no, this really isn't normal. Like I went to bed at 8:30 and I woke up at 7:30 and I shouldn't be so tired that I can't literally get my legs out of bed. And so I just kind of got frustrated. I was like, this is not normal. This is not how I want to live my life. And I knew something was wrong because also I wasn't having normal menstrual cycles. I'm in my mid-30s. That's a problem. That's a problem for your bones. It's a problem for your brain. It's a problem for your heart. It's a problem for your mood. And so there's signs that, hey, your body's not functioning well. I lost my eyebrows. I was like losing massive amounts of hair. This is not normal. And so finally I was just like, I was fed up. So I went on the internet and I started like looking up Hashimoto's and other ways to treat it. Kind of got down this rabbit hole with your gut and started reading about how, hey, if you have Hashimoto's, sometimes not eating gluten will help. And I was like, that's interesting. So I stopped eating gluten. A week later, I'm like, I actually feel better. So it was these things where I was trying these little things, but I didn't really know how to put it all together. I ended up finding a guy in Dallas who's a functional medicine provider who did a lot with gut health. And so I went and saw him. And he's like, let's look at your gut. Let's do a GI map. Let's just see what's going on. Lo and behold, my gut was the typical Hashimoto's gut, meaning I had bacterial overgrowth of Klebsiella and Proteus and all the bacteria we see in people with Hashimoto's. And he explained to me how those bacteria actually further attack your thyroid and they downregulate the hormones that like estrogen and progesterone. And he explained to me exactly what was going on in my gut and how he knew different bacteria do different things in your gut and then how that affects the production of estrogen, progesterone, and testosterone. And everything he explained made sense to me, understanding physiology. And I was like, okay, worst case scenario, I've tried for 10 years other things. I'm going to listen to this guy. I went on a gluten-free, dairy-free diet, almost like an AIP diet, which was kind of hard, but he was like, do it for 90 days and just see how you feel. And within
What's AIP?
AIP is autoimmune protocol. So it basically is, I call it the no fun diet. No caffeine, no chocolate, no sugar, no dairy, no gluten. It's just a very anti-inflammatory, probably what our grandparents ate, basically. Good, whole, single ingredient, nutrient food. After 14 or 15 days, I was like, I feel drastically different. Is this real? I'm like, is this in my head? But I felt different. And I was also monitoring my labs because I cared about my labs. And so doing this diet and doing this protocol where I was trying to get rid of these bad bacteria and just doing the things he taught me, within about 2 months, I had a period. And I was like, okay, this is great. I have a menstrual cycle. I hadn't had one in 9 months. And then 31 days later, I had another one. And then 32 days later, I was like, obviously something is working here, right? Because I haven't had normal menstrual cycles in 10 plus years. And this is the only thing I've done different. And it wasn't that I lost a ton amount of weight. It was just that I felt better. I was sleeping better. My stomach didn't hurt. I could actually wake up. And so that's kind of where it started with me was I was like, wow, there's something really here with this gut thing. So then I did do the research to see, is he telling me the truth about, hey, these bacteria do this and they actually affect this. And the more research I did, the more I realized, wow, he really is. So I started doing this with my own patients. And now I've looked at thousands of gut studies, and I can almost tell what's going on with a patient just by looking at their gut study. And I've had thousands of people get better. I've had people get pregnant after IVF that have told they can never get pregnant. I've helped all these people, and I'm like, this is definitely the missing link, because once you calm somebody's gut down and you get all that bad bacteria out of there and all that inflammation, guess what? Those doors, they line up and they just open right up for hormones because there's no inflammation. And so that's where everything gets better, is when you get rid of inflammation. And most people's inflammation is starting, or the root cause is their gut, and they don't realize it. And so I put all this together, this 10 years of knowledge, myself, thousands of patients, into my book, because I was like, people need to know this. And I tried to make it as lay terms as possible, laid it out by chapter and different disease processes and how hormones work, but it works. And it's the only thing I've found to work, because I've tried so many things.
Phil, you've got to ask some questions here because I'm not smart enough at this point I want to dig deeper.
I didn't know if you wanted us to get too nerdy on this.
Well, I'm kind of feeling a desire for
there.
nerdiness at this point. This is fast. And I have so many female friends, and I may be dealing with it as well. I don't know. But so many female acquaintances, friends, family who seem to all deal with the same kind of stuff. And I've heard Hashimoto's and thyroid and hormones, and just you hear that stuff all the time. But this feels, and I literally mean feel, it's intuitive right now. This feels, there may be some commonality here. And but I don't know enough to understand the questions even to ask.
So let me try to break down for you just why your gut is so important in general for hormone health. I think this is where people get really, when you start telling them like, hey, you can't eat gluten and you can't eat sugar and you can't eat dairy for 90 days. They're kind of like, and you can't have alcohol and you can't have caffeine. They're like, yeah, I'm out. But this is what I tell people. So your gut, your GI tract, it's like think of it like a water slide. From your mouth all the way to your anus, it's this condensed water slide where water can run through it, but nothing's supposed to come out of it. Completely encased water slide. And the point of that is our GI tract is actually an endocrine organ. There's tons of hormones that are made in our GI tract. We extract serotonin and dopamine from our food, which is what keeps us happy. This is also why there are millions of Americans that are depressed and anxious who see doctors and get put on SSRIs and all sorts of medications to help their anxiety and depression. They'll try 3, 4, 5 of them. They say nothing changes. They still feel terrible. They all have a gut issue because you make serotonin and dopamine in your gut. And if your gut is broken, you can't make it. And no amount of SSRI or psychiatry prescribed medication will make that better. You have to fix your gut so that you can make the hormone that makes you feel better. But so this tube that our gut is made for us to put food into it, nutrients, and then as it travels to different parts of our body grind up the food in our stomach, and the acid in our stomach make sure that nothing bad is going to get into our body, bacteria, fungus, parasites. It takes our food and breaks into tiny little pieces so that when it leaves our stomach and goes into our small intestines, the bacteria in our small intestines can then extract the nutrients it needs. We have tons of nutrients we need: iodine, iron, B12, vitamin D, all these things that our body actually needs to make hormones, to actually make our thyroid hormone, to make our sex hormones, to give our mitochondria energy. And so the point of our GI tract is to extract nutrients and micronutrients from our food and then give it to our body so that our body can have the building blocks it needs to run our car. Think of us like a car. The problem is that most people don't, just to start, their stomachs don't work right. Most of us don't have the right amount of acid in our stomach. Why is that? We drink too much caffeine. We stay up too late. We eat ultra processed foods, and millions of us take PPIs, proton pump inhibitors, because we go to a doctor one time and tell them we have heartburn, and they just write a prescription for a medication that was made to be taken for 14 days, 28 at maximum, for acute gastritis and ulcers. But millions of people take this medication for years. And so now the acid in their stomach is not formed. So every time they eat food, their body can't do anything with it. It would be like putting diesel fuel in a car that takes gasoline. Your stomach's like, what am I supposed to do with this giant food bolus? I can't break it up into little parts because I have no acid. So then the millions of people that take this medication, when they eat, the food leaves their stomach and goes to their small intestine in this giant bolus. It's huge, like all these big food particles. And their small intestine goes, what am I supposed to do with that? I have this tiny little thing where I'm supposed to extract nutrients. This isn't a giant food ball. What do I do with this? So what happens is we have some bacteria in us that are considered, I call them bad bacteria. They're there for a reason, but they're not supposed to be in high numbers. Those bad bacteria love those big food bolus balls. That's what they eat. They eat all the sugar and all the big unprocessed food. So the bad bacteria, the Proteus and the Klebsiella, the ones that I mentioned that actually cause disease, they go crazy. They love eating that food in your small intestine that couldn't be digested in your stomach because you didn't chew your food, you didn't sit down when you ate, you were chronically stressed, you're on a medication, you didn't get enough sleep, all these things. And so the bad bacteria in your small intestine, they go nuts when we eat these ultra processed foods and we're not being nice to ourselves. Now, as the bad bacteria eat, they produce something called LPS, lipopolysaccharide, which is toxic to our body. So as they eat, it's like they're letting off this signal as they eat that causes our immune system to go crazy. LPS puts our immune system into overdrive, and our immune system's, oh my God, we're being attacked. What's going on? Our entire body comes to our small bowel and is like, what is going on? Meanwhile, the good bacteria over here that are supposed to be extracting our nutrients so that we can make our thyroid hormone and we have energy, they're starving because they can't eat these giant food boluses and our body didn't break the food down correctly for it. So it's, I'm hungry, but the big bacteria are eating, the small guys, they can't get in there to eat. So now after you've eaten, you have bad bacteria creating all this big, nasty inflammation. It's like they're setting a fire, and your good bacteria that are supposed to be feeding you and your body are starving. And that's why most people after they eat feel like crap, because their good bacteria are still hungry and their body still needs nutrients, but the bad bacteria ate all the processed crap that they ate. And now they're spewing off these things called cytokines, which drives our insulin up and it drives our cortisol up, which makes us feel tired and it makes us feel inflamed. And when our insulin's high, we can't make estrogen. And when our cortisol's high, we can't make progesterone, which then that messes with our mood. And then estrogen and progesterone backfire in the fact that estrogen and progesterone, when high, kill good bacteria. And when they're low, then they can't. And so it's just like this vicious cycle of things that are happening just from, for example, your stomach not working correctly. And so all that snowballs. If now you're not making estrogen and progesterone because your cortisol and insulin are high, guess what? You're going to start storing everything you need as fat because insulin causes you to put food into fat cells instead of your skeletal muscle. Now you're hungry again 2 hours later, even though you just ate, because all your food's going to the wrong place. And also your good bacteria are starving. And so it just makes these chronic disease processes of I started gaining weight even though I didn't change my diet, and I keep gaining weight and I keep gaining weight. And maybe I'm even eating less, but I'm still gaining weight because even though I'm eating less, my cortisol and insulin are still high because I can't digest my food correctly. And so I still gain weight. And it's just every hormone you can think of is being affected by your gut. Does that make sense?
Oh, yeah.
Yeah, it's almost, I think of it these days that the body is just sending all of these signals and somehow we continue to ignore and miss them. So how often do you now experience that someone comes to you and they've had years of, let's pick thyroid, right? They're on the thyroid medicine for years. They're really not getting better. They're being managed, and you bring to light these issues and we address them with the changes in the diet, the lifestyle, all of that stuff, that the thyroid problem now actually resolves. And either they don't need medication any longer, or they need a lot less of the medication, or at least the medication is actually doing what it's supposed to do and they actually feel better.
I would say, to answer the first part of the question, most of the people who come to see me at this point in my career have been sick for 5 to 10 years. They've seen a lot of doctors because I don't take insurance anymore. So I'm completely cash-based functional medicine practice. So people that come to me want to be there. And a lot of them have been sick. I saw 10 people today, and of the 3 new ones I saw, one of them had been sick for 23 years, has seen Mayo Clinic, has seen all of these great doctors, and is still sick. I would say when you're that sick, we have programs we put people through. Typically, it takes about 6 months because we have to start with, I tell people we have to start with your cell membranes, that thing I told you about, the door that's crooked. We've got to get your cell membrane to work. It doesn't matter what hormone I throw at you until your door's open, until your cell membranes are fixed, we can't fix you. And so we literally start at the very basic, and we do that by starting with their gut. So we start with your gut. How do we start removing inflammation from your gut so that we can fix your cell membrane doors? We talk to them about sleep. We talk to them about nutrition, about movement, about sunlight, about relationships, about how they talk to themselves and the things that they think, because all of these things actually affect your gut. Stress is one of the worst things on your gut. And so it takes our patients usually 6 months to really get better. And I have people who come to me, all of them will tell you within 4 to 6 weeks, they're like, wow, I feel astronomically different. But usually by the time people get to me, I nicely like to refer to them as a metabolic dumpster fire because their insulin's high, their cortisol's high, their thyroid's not working, their sex hormones aren't working. This has all affected their growth hormone. Now they're not sleeping well, which is further making this worse. And so it's a full pituitary, adrenal, gut axis that you have to fix because it's all intertwined. But we have a 6 month program, and I would say 95% of people are better in 6 months. Some of them it takes longer depending on how sick they've been. It also depends on how much they're willing to contribute. But I deal with some very sick people. I've seen people I have one girl who didn't get out of bed for 3.5 years, and she walks in my clinic now every 3 months. It took a long time, but everything was so depleted. So it's not an easy process. But the other thing I tell people, and this is my favorite quote, health is not owned, it's rented, and the rent's due every single day. So first of all, if we're going to start fixing this, we're going to start, but you got to be on the train. It's not hey, I'm going to put in some work for a week and then I'm going to go on vacation for a week and undo everything I did. We're on a health journey. Not that you have to be perfect, but we're on a journey and we have to start changing lifestyles, because if we don't change our lifestyle, we're just going to end up right back where we were. You literally have to pay your rent every single day.
That's a good way to say it.
Yeah, every
Health
day.
isn't owned, it's rented.
And I read that. It's been on my fridge since the day I got sick in 2020. And I decided it was a lot of money I spent in 2020 to go see this doctor. And I put that quote on my fridge and I read it every single day because it's true. Some days I wake up and I'm like, man, I just want to drink a bottle of wine and eat a cookie. Everyone gets into those days, right? Or I don't want to go to the gym today, or I don't want to, but you just have to remember that all that stuff adds up. So do I not want to do this and just feel like complete crap tomorrow? And so it's a balance, but you didn't get sick overnight and you're not going to get well overnight.
I've heard that myself.
Yeah.
Yeah.
What's your perspective on how much of the testing do we need to figure this out for people versus how much is just there are common themes that we really don't need to test for. We know everyone has these things going on.
To be honest with you, I probably, Dr. Phillip, could make 85% of people better without a single test, just by talking to them. Tell me the truth about what time do you go to bed? What time do you wake up? Do you feel rested in the morning? What thoughts are going through your head? Tell me about the 5 closest people around you. Are they mentally, emotionally, physically healthy or not? Tell me about the food that you eat. Do you see the sun in the morning? Do you see it at night? How much do you move your body? You can tell a lot about somebody. How do you deal with stress? How stressful is your day in general? You can tell a lot by somebody if they'll truthfully answer those questions. Because if they're running in the red on every one of those, you know they're chronically stressed. You know their insulin's high. You know their CRP is high. You know their sex hormones are tanked. They're not converting their T4 to T3. Their gut's a mess. Also, I ask people about gut symptoms, and that's something we haven't talked about. I ask every single patient, number one, do you poop every day? You should. If you eat every day, you should poop every day. It is not normal, no matter what condition you have, to not go to the bathroom every day. And there are women who come to me who poop every 2 weeks and they have their whole life. And that is how we clear toxins out of our body, especially estrogen. And I talk to people about that too. How often do you go to the bathroom? Does your stomach hurt after you eat? Do you have heartburn? Any of those things, to your point, are signals and signs from your body. If your stomach hurts every time you eat, if you're not going to the bathroom, if you feel bloated, your body is screaming, this is not normal. If it could send you a text message, it would be like SOS, this is not okay. But it can't do that. It gives you a symptom. And so I talk to people about all those things. And then do I actually need hormones to tell them they're a metabolic dumpster fire? No. But do I get them to show them some more proof to maybe get them on board? I do. And I do gut studies if people will do them because I love to show them, hey, let me show you what's going on in your gut. But to be honest with you, if you're just listening to this, wow, where would I start? And I have a whole chapter in my book of where would I start without a provider, without anyone. It's remove ultra processed sugar foods from your diet, period, full stop. Because most people eat so much crap, which means I look at a food and it's a single ingredient whole food, or if I'm looking at a label, it has single ingredients and no more than 5, and sugar can't be on the list. That's it. If 80% of America did this, you might be out of a job and I might too. And that would be great. But it's just, that's one thing. It's look at what you're putting in your body, right? You would not drive I ask guys this all the time. Would you drive a Ferrari to the gas station and put diesel fuel in it or put sugar water in it? And they look at you like you're crazy. I'm like, what are you putting in your body all day long? So that's one thing. And then the second thing is, do you move your body? Do you stretch it? Do you go outside? Do you move it? Do you see the sun? And then how much do you sleep? Those 3 things right there are huge, huge, because most people will tell you they don't sleep consistently. They don't sleep at least 7 to 8 hours a night. They don't move their body because they're stressed or these are just very simple things that you can do and feel a lot better.
No sugar, more sun, better sleep.
It's not that hard, but it's not sexy. It's not fast. It's not easy. So nobody wants to talk about it. Right? It's just, oh, give me the pill, give me the whatever, because I just want to keep going. And the problem is that the pill eventually is going to stop working. There's only so long the bucket can sit under the leaky faucet. And then once that faucet explodes underneath, then we're in trouble, right? Then we need you to come fix us. Then it's really bad. So that's the problem.
It's been a while since we've had someone on the show who just was able to simply consolidate 5 years of what we've been talking about in such a short amount of time. But really, that's what Cassie just did. That was pretty much it. Quit eating crap, get decent exercise, get out in the sun, fix your sleep, reduce the stress.
Yeah. And a lot of it is, I'm very interested in chronic stress. Stress literally kills people. This is why Dr. Philip has people on his operating table is stress, a lot of it, and what they're putting in their mouth. But people don't understand what goes through your head and literally what you feel and what you let dictate how you feel. You have something called a vagus nerve where your brain is connected to your gut and your gut is connected to every organ in your body through something called the vagus nerve. And when your body feels stress, whether it be like, oh my gosh, I have this sticky note of stuff to do that I didn't get done, or man, that person at work really made me mad, or I have to go pick up my kids, or my husband was mean to me, whatever is going through your head. I don't like the way I look in my clothes. Women, we're the worst. Oh my God, I look fat in this. We're the worst. That sensation, your gut actually feels from your brain and your body. And when your gut's chronically in this, it actually activates cortisol and insulin. And that's why a lot of people have such bad guts. And over time, that chronic activation of cortisol increases insulin, which increases fat storage mode, which increases our cholesterol, which increases our adipose tissue, which and then we end up with heart disease and we end up with cancer. Cancer is just I truly believe that cancer is your body telling you it doesn't like its environment. You've allowed your cells to fold and replicate in ways they shouldn't because your immune system wasn't able to go and recognize that because it's too busy trying to figure out what's invading its gut every time that you eat, or what sort of negative thought is happening. Are you dying? Is a lion coming after you? Just because you look in the mirror and you think, wow, I don't look good in this. So stress is something, and I have a whole chapter in my book about that, about how people just don't know. Either they don't know how to cope or deal with stress these days, or just we're so overstimulated, there's so much of it that it just kind of rules your life, and it really shouldn't.
Yeah, I lived what you described. That was my life exactly. 20 years ago was the state I found myself in, and it was just due to years of chronic stress. Thank God it was caught before it turned into a heart attack, but all the other things you described, yep, that was me.
And I bet your stomach hurt. And I bet
well, in fact, the thing that drove me, the last straw for me was I had chronic heartburn, just could not get it to stop. Went into a doctor, and he did exactly what you described. He spent 7 minutes with me, prescribed proton pump inhibitors, and intuitively, I knew that was just nutty. He was giving me a pill to stop a symptom, and I knew that the symptom was pointing to something else. And that sent me on my journey. And ultimately, it boiled down to, yeah, years and years of chronic stress, cortisol that was completely out of control, adrenal glands that were exhausted. I put on, I'm a tall, relatively thin person, and I put on 50 pounds in that time. I see photos of myself from back then and I think, oh my Lord. But it was all the things you just described. And I was somebody who tended to sleep healthy, eat healthy, got plenty of exercise, always slept good, but I had an extraordinary amount of stress in my life for years. It was literally stress that did it to me. So I'm here to say, amen, sister. Preach on.
Thank goodness, Jack, you didn't take that PPI because it would have been like pouring gasoline on an already burning fire. And that's the problem is most people don't realize that they go to their doctor, gives them metformin, birth control, PPIs. I write about this in my book, all these things that kill your gut, and it just makes it worse.
Sorry, didn't mean to hijack it there, Phil.
No, it's good. But yeah, it leads, you've probably had the experience that I have, right? That you wrote the book and you sit back and kind of think about what you said earlier, right? That it really, if people could just do three simple things, right? Stop eating crap, get out in the sun and get some sleep, 90% of this gets better. What though are some of what maybe the top couple of unrecognized insults to the system, we'll call them, right? That people, they're not thinking about, but they're big problems that are compounding everything.
Yeah. Stress is the number one. I have people tell me all the time, I've been stressed for 30 years and that's not going to change. So this is not the reason I'm sick. And I'm like, okay. I mean, I don't know what to tell you. If you want to go to the root cause of why you're sick, it's your stress. So I just think that, and some people don't feel like they're stressed because, and this may be like you, Dr. Phillip, but for instance, I saw a surgeon today. I saw a heart surgeon today, and I love her to death. She's a vascular surgeon, waking up in the middle of the night, fixing dissected aortas. And I'm not stressed. And I'm like, really, what were you doing at 2 a.m.? And she's like, I got an emergency call. I was fixing a dissected aorta. And I'm like, and you're not stressed. And you were dead asleep, and then you've got somebody's heart in your hand. Really? Because I think some people are just like, they just get used to it and they don't realize that this is not normal. And so what I said to her and what I like to say to people is, okay, if you were in a quiet room right now, if I shut this light off, walked out of this room and left you in this quiet room, could you sit here and calmly meditate and just zen out and go to an area and have nothing going through your mind? Most people will tell you no. And most people, it makes them very uncomfortable. This is why people don't like yoga. They don't like, because it makes them uncomfortable because their central nervous system is so haywire all the time that when you try to put them in a parasympathetic state like that, they don't like it. Their bodies, and that's how you know something's wrong. You should be able to just zen out. And so I think one of them is people just don't realize how chronically stressed and stimulated they are. These things right here, our phones are chronically dinging and binging and our computers. And so that's one of the big things that I think people don't realize that really affects their health is stress. People know they're not supposed to eat like crap. People know they're supposed to move their body. I think sleep is another big one because there's so much different information out there. Some people say, oh, you can sleep when you're dead. Some people say, oh, 5 hours is plenty. The scientific answer to sleep is that your growth hormone is made between 11 and 2 a.m., 11 p.m. and 2 a.m. Doesn't matter what you think your body's circadian rhythm is. Where you are located right now and the sun comes up and down, your body gets on a circadian rhythm because of the light color spectrum in sun. And from 11 p.m. to 2 a.m. roughly, your body will make growth hormone if it is allowed to do that. Growth hormone is what is going to stimulate the production of your hormones for the next day. If you are not asleep in deep REM sleep, or at least starting to get into REM sleep and in theta and delta, you won't make growth hormone. And so there are tons of people who also are like, well, it doesn't matter. I sleep from 3 a.m. to 8 a.m. or I said, yeah, how do you feel when you wake up? Like complete crap because you didn't make growth hormone for the day before. And growth hormone is what also, there's a lot of longevity data tied to that. So I think also sleep gets a lot of negative, bad rap or just not the right information. You need to sleep 7 to 8 hours a night. You need to get about 2 hours of REM sleep, and you need to be asleep from 11 p.m. to 2 a.m. so you can make growth hormone, period. Full stop. And that doesn't mean you're in bed scrolling on your phone, or it means you're asleep, like out.
That's the
So I think that's another one.
that's tied to the rising and setting of the sun, the light that
Yes.
is in the environment.
The,
And
the
there's
colors.
the
Yeah.
colors, yeah, the colors of the light.
I
Now,
talk
that
about
could be
that in
a
the
whole
book too.
nother episode, Phil.
Yeah.
Yeah, I know we got a
That
couple of
that
things
kind of
that could
stuff
be
really stokes me.
whole other episodes. One that I'd love to touch on real quick, peptides. I
Oh
know
yeah,
it's something that
I'm
you
thinking
use in your
testosterone
practice.
here.
Yeah.
Yep, we do as well, but I'd love to hear your thoughts on it and just give us the overview of how it plays into all of this.
So I love peptides in the right patient. So the patient who comes to you who's a metabolic dumpster fire and just wants a quick fix, peptides aren't really going to help you. If you're throwing seeds onto concrete instead of putting them in soil that's ready for them to help something grow, a peptide's not going to help you. If your gut's inflamed and you're burning the candle at both ends, but if you are doing the work, peptides can change your life. And I've used probably every peptide there is on people for different things, but tesamorelin is a wonderful peptide. Caveat to that is only contraindication. You obviously shouldn't be doing a growth hormone peptide if you have any form of cancer actively. But other than that, or a pituitary tumor, which would be very rare. But people who have issues with sleep, people who are starting to lose muscle mass if they're really sore after they exercise, as we age, our growth hormone production unfortunately decreases. This is why as people get older, they tell you, I don't sleep as long, I don't sleep as deeply. When I exercise, I'm more sore. When they need to recover from something, it takes longer because we make less growth hormone as we get older. Cimarelin is a way to give your body back growth hormone. It's not the exact same thing, but it helps trigger your body to make its own growth hormone, and it also gives you a little bit of growth hormone. So I like it because it's hey, pituitary, make growth hormone, but also while I'm trying to retrain you to make more growth hormone, here's a little bit of growth hormone so you feel better. And so it's a combination, but I love it. It makes people sleep deeper. It makes people feel better after they exercise so they're not so sore, helps with recovery, muscle recovery, tendon recovery, and it actually will help with muscle mass and building muscle mass, assuming you're eating enough protein, moving your body mechanically how you're supposed to, and you have actual androgens. And that's in a female too. Testosterone. You need testosterone, you need protein, and you need movement in order to build muscle. So it helps with all of those things.
I
Great
all think
stuff.
we could do more.
Yes, no, definitely going to have you back on, Cassie. But before we wrap up, tell people about your practice and where we can find you. And then obviously the book for those that are watching right behind you, Fix Your Gut, Fix Your Hormones. But for those that are listening, we'll tell them where they can get that as well.
Yeah, thanks. So my practice is called Modern Endocrine. We have a physical location in Oklahoma City. I actually built a state-of-the-art clinic here where we do all functional medicine stuff because I built what I wanted 10 years ago as a patient. We have the only red light therapy bed that's like the FDA approved level red light bed. We have cold plunge. We do ozone therapy, all sorts of IV therapy, aesthetics procedures, hormone therapy. So we have a clinic that's amazing that I wish I would have had 10 years ago in Oklahoma City. But we do provide telehealth in 46 states. So every state other than Oregon, Rhode Island, Massachusetts, and Alaska, we do telehealth. And so www.modern-endocrine.com is our website. Our book you can find on Amazon, Fix Your Gut, Fix Your Hormones, but there's also guthormonefix.com. If you go there and sign up, then you'll get all this free information like dietary guides and like this reference that you can have as you go through the book where I give people like labs to get, reference ranges, things like that. But the book's on Amazon, and I actually just finished the Audible version yesterday, so it'll be out soon because it's a big book. It's 400 pages, you guys. I didn't want to write another book, so I put it all in there. My publisher was like, let's make 3 books, and I'm like, I don't want to do 3 books. Just give it all at the same time. So it's a lot. And so I tell people like, look at it and start where you want to start If you start from the front and go to the back, it's the way you should progress through it. But if you have a certain disease state, there's disease states in there. You can just go there. But my goal with the book, and it's a lot of work, you know this, was just like, I want to educate people. I want people to feel better. If everyone in the world felt 10% better, imagine how much better the world would be. And it's really not that hard to make you feel 10% better. It's not. It's just that we have not a good education system, and we have a lot of doctors that aren't educated too. And so I wrote this for providers too, because when patients come to providers, I want them to start thinking differently. Instead of just writing a script, how do we actually fix the root cause? Because we have really sick people in this country and in this world, and we just need to do better.
Awesome. And we'll make sure all the links are in there. The practice is at modern-endocrine.com for anyone looking for that. But it's great work that you're doing, great things that you're talking about. And like Jack said, there'll definitely more than enough for a part 2 here at some point in the future.
I would love to come back. We'll talk about whatever you want.
Sounds good.
We didn't even get to the hormone stuff and the WHI and any of that. So we definitely.
No, we did not. We barely scratched the surface, but I really appreciate the really cool summary of really everything we've been talking about for the last 5 years. Pretty simple. Our guest has been Dr. Cassie Smith. Her website is modern-endocrine.com. All the other contact information, like Phil said, is available on the show notes. For Dr. Philip Ovadia, this has been Stay Off My Operating Table. We'd love to see you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.